Hi, I'm Suze Shaner with Sage Leadership Strategies, and I'm your host today of Community Forum. And my guest today is Dr. Roberta Kline, who is a board-certified OBGYN, genomics specialist, and an integrative physician whose mission is to change how we approach health and deliver health care. And for over a decade, she's been on the forefront of educating and mentoring healthcare professionals in an integrative approach to functional genomics. And she's currently adjunct faculty at the University of Western States. And one of her key focuses is she is very strong on empowering women to create balanced health and leading fulfilling lives. She's also the education director for the Women's Health Collaborative and the Women's Diagnostic Network, and serves as editor for several online health publications such as Balance and Longevity, Women's Health Digest, and Journal for Modern Healing. Welcome, Dr. Kline.
Thank you, Suze. It's good to be here.
Well, great to have you on the show. And in full transparency, I'm going to let our guests know, I do call you Bobbi because we grew up in the same town. Our mothers were really good friends. So I know you as Bobbi.
Yes, totally fine.
But she is a legitimate doctor. Okay, and that's quite a lot. So we want to talk a little bit about genomics and holistic healing and all of that today. But I'm wondering if you can give us an overview on how you got here with your very specific and prescriptive perspective and approach to health and women's health. If you could talk a little bit about your personal healing journey and your professional development and how that's kind of all integrated.
Yeah, a very winding road. But really the starting point was I was practicing OBGYN, and I just felt frustrated. My patients would come to me with questions that I couldn't answer. I'd go out and research, and I just felt like I lacked so many tools. I didn't have what I needed to answer the questions in a really deep way. Why did I get this? How can I really do something that works for me? So I couldn't figure out a way out of my OBGYN practice. The logistics were difficult. So my first real mind-body experience that I was aware of was I got a shoulder injury. And I had had multiple injuries along the way, but this one stopped me in my tracks. It had to be something that I couldn't practice anymore. So
you couldn't practice medicine?
OBGYN. I ended up having surgery to see if that would fix it.
You were delivering babies.
Yes. I was delivering babies, I was doing surgery, all requiring a functional shoulder. So the orthopedist said, I don't know what's going on, but let's do surgery, clean things up in there, and maybe that will help. But it will require 3 months off from work. And I said, oh, thank God, because I need 3 months to figure this out. Where am I going to go? How am I going to change course?
Yeah. What was it like for you to suddenly say you can't practice medicine?
I could still practice medicine, but I couldn't do OBGYN. And I was relieved because I loved what I did. I loved my patients, but I knew I was here for something different. I needed to move into something different, and I needed help doing it. I couldn't.
So you had that sense then?
I did.
Because I mean, it must have been. I imagine, I don't know, rewarding delivering babies. I mean, it's like a miracle every day.
I loved it. I loved it, and it wasn't the work that I didn't like. I loved working with my patients. I loved my job. I was exhausted. I was, trying to raise 2 kids, working part-time, 60 to 100 hours a week.
100 hours?
Yeah, as an OBGYN with call, it was
That's
grueling.
Insane.
And I needed more time to figure out where to go.
Yeah.
And to bring in more modalities, a deeper way of helping women heal.
So interesting though, you said, so it was a relief, I can imagine, just to even have some downtime.
Yes.
But also, it sounds like deeper underneath that is you just kind of intuitively had a sense, I meant to do something different.
Yes. Yeah.
So where did you take it?
It was a long recovery. I was out of work for 1.5 years.
Oh.
Shortly after surgery, the physical therapist said, "You're doing fine. You'll be back to work in no time. You're not going to need 3 months off." And I said, "Oh, but I need that time. And I got a frozen shoulder. I mean, the mind-body stuff is really pretty incredible.
So literally frozen.
Literally frozen, yes. And that set me on a healing journey. Several months later, more physical therapy, and I still wasn't better. And the orthopedist just finally said, you got to suck it up and just go back to work like the rest of us. And that's when I knew I needed to find a different way of healing. I was not going to find it among my very safe area, the arena that I had been practicing in. I needed to go outside, and I was scared. I didn't know a lot about the alternative medicine community. Yeah. Who would I find? How would I find the right person?
Because you were trained as a traditional
I was trained as a traditional doctor. Okay. And so I used my intuition, and the universe sent me who I needed at the time that I needed them. And then I enrolled in an energy medicine program, a 2-year certification program for my own healing. And through that opened up doors for me. I ended up opening up a holistic women's health practice and integrating some of the women's health, the gynecology part, as well as the energy healing part, some more spiritual aspects. That's when I got introduced to human design.
So let's talk about this for a second. So yeah, how do you, I don't know if this is the right word, but reconcile or integrate, you're a scientist, with this energy spirituality? Because some metaphysicians might say that emotions sit in the shoulders.
Oh, absolutely.
Like what you're carrying.
Oh, absolutely. Yeah. And my energy medicine program was taught by a psychologist. So it was all mind-body stuff woven in. That has been one of my challenges, to weave together these multiple parts. I am a scientist. I research. I love diving into the biochemistry and the genes. I also love delving into the emotional and energetic component, and I think at the end, because they're all true, they all have a truth in them, and that's the common thread.
Yeah,
They're all interwoven for health, and they all need to be addressed on some level at some point.
It's interesting because I kind of look at them like different domains or portals, whether, mental, emotional, physical, spiritual. It's like, what's your entry point?
Yes.
So what would you say to that?
It depends on the person and where they are and what they need. And I think that is what's challenging when you have multiple portals. There is no one way to do it.
Yeah.
So ultimately, it's about where is that person at that point in time? What do they need first?
Yeah.
Sometimes they need help with their physical health. Sometimes it's a spiritual, emotional issue that needs to be addressed first, even though they're presenting with that physical health issue. So it really depends on the person.
So that's really interesting. So as a doctor, when you're doing your diagnostics, and you're getting to know the person, they probably come to you with some sort of presenting physical problem.
Yes.
Then, and I know you do a lot with genomics and biological testing and human design. So let's kind of talk about all of that. Like what is human design? How do you bring in the genomics? So when somebody comes to you with a presenting physical ailment.
So human design is a relatively new synthesis of ancient modalities, primarily the I Ching, which is the book of changes, the astrology, the chakra system, and the Kabbalah. And then it's activated through the neutrino stream. And that gives
activated through what?
Through the neutrino stream, which brings in physics.
Can you say for
neutrino?
Can you say for our viewers what that is exactly?
The neutrinos are subatomic particles that are throughout the universe, charged energy particles. Okay. They get activated at the time of your birth and 3 months before birth, and those get put into a 2-dimensional human design that we use. So it's an energetic blueprint. And what I like is that it gives me insight into somebody's psycho-spiritual elements, as well as how they're energetically designed to move through the world, interact with others, and a very reproducible, concrete way for them to tap into their own inner decision-making process.
So this is, it sounds like really a spiritual discipline.
Yes.
I teach and study and do readings on the Kabbalah, which we've talked about. Yeah. So it's a spiritual discipline that you're using to use as one of your tools and methods for diagnosing and treating, right? Would you say that?
I don't diagnose with that. I don't diagnose.
Okay.
I think what I do is I use it to help somebody tap into what's going on underneath. I think so much of what we see that ultimately manifests as physical health starts in, the spiritual, energetic realms before it comes into the physical. And it's the conflict between who we really are and who we think we're supposed to be. And that creates so much stress on all levels of our being that when we can tap into that and suddenly see, oh, that's me. I don't have to be that person I thought I was supposed to be. It relieves a lot of that imbalance. It relieves a lot of that tension that allows somebody to take all that energy that was getting put into that struggle and all of a sudden freeze it up so they can actually do their own healing in whatever realm that looks like.
It's interesting you using the word freezing, because when you were talking about your frozen shoulder, because what you're really saying is, okay, frozen shoulder, as an example, we can treat it, we can do PT, all this great stuff that Western medicine has to offer. But if you want to kind of get behind what could be an underlying root cause of it, then you're dealing in the emotional, spiritual, psychological realm. So it sounds like you're really working in sort of both domains, this very spiritual domain and this medical.
And I think, and they are intertwined, but sometimes one takes precedence over the other, and it really depends on where the person is. For example, I had a woman who came to me who was diagnosed and recently treated for breast cancer and wanted her genomics to understand, okay, why did I get this? What can I do differently? She was very proactive in the integrative health realm. She says, okay, I know this can help me get to the root. So we did. We looked at her genes, her biochemistry, and how that potentially might have contributed to the development of breast cancer. But I also looked into her family history, on an emotional level, on a psycho-spiritual level, and into her design. And I spoke with her about childhood trauma, and that was actually one of the big messages coming through her physical illness that would be beneficial to look at as well. And she already was aware of it, but by me pointing it out, saying this is equally important, it helped her validate and say, yes, I will go get help for that. She had done work on it already, but she said, I clearly need to do more work and see where to go with this.
Well, how validating and unusual for a Western-trained medical doctor to validate her on this emotional, psychological, and spiritual way that is directly connected. So interesting that you're looking at the biology, the biochemistry, then this whole other spiritual piece. I mean, I've often heard that biology shows your biography, which is really what you're saying.
Absolutely, and for me, it's in the genetics, it's in the epigenetics. Trauma is passed down through epigenetics. There's all of these layers that influence the physical health, which is usually why we come for help. It's certainly, to me, sometimes it's the emotional health, and I'm sure for you, that's probably the primary presenting thing. And for me, it's something gone with their physical health that they want help with.
So at what point did you start putting these pieces together, like this energy work, the genomics? Because now there's, with 23andMe, Ancestry.com, I mean, I've worked with a naturopath, and I'm a little skeptical about sharing my DNA results, because I don't want it to get out there, and what are the insurance companies going to say? And, I mean, I hear what you're saying. It's good to get the information and see how you can pull together the complexity of somebody's whole, energetic, biological, psychological, all of that makeup. And yet, where's all this information going to go, and how's it being used?
Well, this is the big thing that I cover both in the teaching that I do as well as with my clients. First of all, I don't use the big commercial companies who are mainly in business for using your data. So that is one. It's choosing who to work with, and I choose clinical companies. I actually ran my own company for about 10 years. I co-founded a company for this. But the other is that People can use pseudonyms. They don't have to put in their real information.
That's what I did. I use a pseudonym, and I use a totally different email only for that.
Yes.
And they also give you the option. I said, destroy it right after you get my data. So hopefully there's no way they can trace me.
Yes. There are ways to circumvent that. There are many labs that I work with on a clinical level that everything is barcode. So there's your name is actually not directly connected. It's multiple steps away. So again, lots of ways you can protect your information. If it doesn't go through insurance, then it's not on public record somewhere.
Yes,
so
that's what I did.
that helps also.
Yeah.
I think like any test, you have to know what to do with it and how to interpret it. There are lots of tests out there that, from my perspective, are entertainment. They're not helpful. And even if you do get the right information, if the clinician is not trained, if they don't know how to go deeper into it, I think it really has limited value.
So they don't really teach you all this in medical school. So obviously, and you started your own company in this space. So obviously, at some point along the way, you went deep in additional studies and training on this.
I did.
And what made you decide to want to do that? And how have you really kind of mined that for its optimal usage, if you will?
I did the energy medicine. I got introduced to the human design. My question is always, what's at the root?
Yeah.
How can I get to the root of this? And I was making progress using functional medicine and an integrative approach, but I kept saying I'm missing something. Yeah. And that's when I started exploring genomics. This was back in 2011. There wasn't much being done on the clinical level at this point. So I researched, I found mentors, and I just dove in and learned it. And then we co-founded a company and taught clinicians how to use a holistic healing model with genomics as part of the framework.
So how would you say, where does this sit from your perspective in terms of the opportunities in the future of medicine?
I think there's two components to this. One is, and this is what I share when I teach this work, you have to have the foundational elements for health. Clean food, clean water, a safe environment. You have to have the fundamentals. Yeah. This is extra. What I see so powerful in this work is that when somebody sees their genes, and again, presented in the right way with the right test, it's very empowering. Yeah. That's why I don't do well on a vegan diet. Oh, my genes aren't designed for that. Yeah. That's why I don't get pain relief when I take morphine. My genes aren't designed for that. So it could really give them insight into why they've experienced things that they've been told, well, you're wrong, or you just need to do what everybody else does. Yeah.
Can you give us another example of one of your patients who came to you for healing in terms of, just like you did with the woman with the breast cancer, in terms of how do they present? Give us obviously with confidentiality, a juicy, complex case, and how you used all these different methods, and how you kind of, with your detective work, got with it a hypothesis on what could be a root cause.
Yeah. I think one of the most powerful cases that I can share with you is a young woman who had just gone off to school, and she had anxiety and depression that became a lot worse. Her therapist said, I think you need medication. She went to a psychiatrist who put her on one medication, who gave her horrible nightmares, didn't really help her anxiety. They added a second medication, which helped with that, but then she gained 20 pounds, so she was put on a third medication. Within 3 months, she was now on 3 medications, and she ended up in the hospital. They said, oh, you have a new diagnosis, a new psychiatric diagnosis, and we're going to up your medications.
It's like, how do you know how much of it is the common? It's like chemistry cocktail.
Yeah. Well, it was a very toxic cocktail for her, because when she came to me, the first thing we did was look at genes that metabolize medications.
Well, Bobbi, how did she even find you?
Through the internet. I
so she was desperate for this can't be it?
Yes.
Okay.
And she was looking for answers. That's how typically what people come to me for. She was looking for answers, saw that maybe I could help. Yeah. So we did a pharmacogenomic testing first, and every medication was toxic, and that combination was hugely toxic. So the psychotic episode that they said she had was a reaction to her medication.
Which makes total sense.
Right? So she actually went off of her medications, and then we did her nutritional genomic profile, which is looking at the genes involving your nutritional biochemistry, what you eat, how you process it, how you manage stress, how you react to things. And so we worked with that, fine-tuned her biochemistry on that. She actually had to drop out of school. She went back to school, and then obviously had more stressors in her life. And she came back saying, I feel like I still need something more. And by this point, I was offering human design as part of my practice rather than just something I was doing on my own. So we did her human design. And one of the key points in there was that for her, she's energetically designed to go through experiences. She is here to try all sorts of experiences. And the anxiety, and she sensed that, but she didn't know which ones to choose. And that created so much anxiety. That alone was, like I said, use your inner decision-making process to decide which experiences you're going to go in. And once you go in, you fully ride them. And then you come out and share your wisdom.
So you helped her articulate what she intuitively knew about
Yes.
who she was in her life process, but in a way it was sort of validating so she could be more conscious and deliberate about how she was sort of managing herself through these experiences.
Absolutely.
Yeah.
Absolutely.
How powerful is that? And especially with mental and behavioral health, it's a shot in the dark. Like, why doesn't somebody take a scan of your brain to see what's the, especially
Yeah.
with depression and anxiety.
Yeah.
It's just like, let's try this, let's try that.
Yes.
It's very experimental.
Yes,
And in her
very
case,
trial and error.
incredibly toxic.
It could have been really bad. I mean, luckily, she was able to find help, but she could have been left on those medications and
And
never
set down the
functioned.
road and somebody thought she has schizophrenia or
Right.
something and ongoing psychosis, but it was all drug induced.
Yes.
It sounds like.
It's very scary.
Yeah.
Yeah.
Wow. So that is a really powerful example. Okay. So it's really innovative what you're doing. And you're really carving out a whole domain. What has been some of your greatest challenges with this work?
Because I don't fit into a box.
Yeah.
I have.
And your colleagues think you're a quack?
Some people, yes. My conventional colleagues think, what are you doing?
Yeah.
You're kind of out there.
Yeah.
And I've learned to let that go. I've
Yeah.
learned to stop trying to prove myself to them. I think I've been in all these different worlds, and I think the challenge is we all live in our own silos. I can see the benefit of all these different things. The challenge is it's a lot to learn, and I love learning,
Yeah.
but they're all of them require lifelong learning.
Yeah.
And how do I weave them together in a way that I can communicate what I do? How do I help people?
Yes.
So that's been a real big challenge.
Well, it sounds to me, in my humble opinion, just listening to you, is that you take a holistic approach, which integrative, yes, that word's out there, but a holistic approach, really with working all of those domains, mental, emotional, spiritual, physical,
Yes.
of assessing and dialoguing and having a human connection with your patients.
Absolutely. I think the healthcare system, the way it is now, is so disempowering, especially for women, people who are marginalized. And I think the common thread for me has been, how do I help people feel empowered?
Yeah, because before we started the show, you were telling me an example of where you had an OB/GYN patient who had just had a miscarriage, and you hugged her afterwards, and all the nurses around you were like, well, that's different.
A common phrase I hear.
Right?
But I was her physician.
Human
Here she
to
was
human.
in the hospital, a very cold, sterile, strange environment. I was the only person she knew. This was very traumatic for her. And it only took 5 extra minutes of my time to just stay with her till she was awake in the recovery room and to hug her while she was crying till she felt like she was a little bit balanced.
Only 5 extra minutes, but what a tender, critical, and what a powerful 5 extra minutes.
It was, and I waited till she was awake enough to remember she did, and she did thank me afterwards. But
That's amazing.
It doesn't take long to have that human touch, and sometimes that's more powerful than any other healing modality that we can give.
Well, which leads me to my next question. I don't want to be presumptive in it, but what's your greatest joy with the work?
My greatest joy, it was when people have that aha moment. They say, oh, that's me.
You got it.
Yeah.
Yeah.
And then all of a sudden, the self-judgment, all these stories they've been telling themselves, now finally have an opening to maybe let go. and embrace themselves with a new appreciation for who they are, their unique self that is beautiful, and they don't need to try to be somebody else.
Well, it sounds like you are bringing head and heart, rigor, and human connection and presence. And that is such a powerful combination to give people a sense of freedom and an opening and a path forward.
Yes, absolutely.
So we've got 2 minutes. So what's it's gone by quickly. Yeah. Maybe I'll have you on again. So what's your vision for where you want to take this work, and how might somebody contact you if they're interested in talking about anything further that we discussed today?
Yeah, my vision, my big vision, is to change how we do healthcare, and that's through education and advocacy. It's also through the internal route. We have to change how physicians are trained. We have to make healthcare a more collaborative type of environment to bring in people with multiple modalities and appreciate them all. And so that is my vision, to change, make it head and heart. And if people want to contact me, they can reach me through my website, which is bobbiklinemd.com. That's BOBBIKLINEMD.com.
Well, wow. What a treat. I mean, there's so much here that we could unpack, and it's a level of depth and a real gift that you're bringing to the world.
Thank you so much. This has been wonderful to reconnect and share this with you, and hopefully it is helpful for the people who will listen to it.
Yeah, thank you so much, Bobbi.
Thank you.
I'm Suze Shaner with Community Forum. Until next time, thank you for joining us.